Good evening, Los Angeles, and good evening, everybody. Thank you so much for joining me again. Today marks the end of a week, and I know it begins a weekend that for many people these days feel indistinguishable from the week. But to all who have been putting in a week of work, as first responders, as those in our hospitals, working in our grocery stores, people who are doing critical jobs, I just want to say thank you at the end of this week as we mark time together, as we look towards the days ahead with optimism and resilience, and we deal with the pain and suffering that's at hand. We're all growing weary of this. We all want our lives back, and we all want to know when we can start taking new steps to safety. So I want to begin with a simple assurance. What we are doing is working. It's not all good news, and it's not all bad news. It's a mix of both because this disease is tough and brings a lot of bad news each night. But the good news is what you've been doing. The good news is your actions, your judgment, your commitment to each other in this city, not to any rules and regulations, but to the people who make up Los Angeles and make this such a great city. Our curve is flattening because you have made very difficult sacrifices, because you're staying safer at home. And we're able to stay at home because our essential workers are out there doing the work that they need to do to keep us safe. Today, May 1st, is International Workers' Day, and we celebrate the hard-won victories of the labor movement, victories that have made life better and fairer for anybody who is working. But it's not just today that we honor workers. We've honored them each day of this crisis, calling them out, naming them, thanking them, and providing them each with the safe and vital protections they deserve. We take care of them because they take care of us. And we protect ourselves and everyone around us each and every day. We make sure we are adhering to what the health experts are telling us, and we make decisions rooted in data. And that's where I'll begin tonight with our data snapshot. I also, as I do each Friday, will offer a comparison to where we were a week ago, so you can have a sense of where we're at, progress that we've made, and challenges we still face. Today, the county reported 1,065 new cases. This brings our total confirmed positive COVID-19 cases to 24,215, a 5% increase since yesterday. 1 week ago, on last Friday, there were 1,035 new cases for a grand total of 18,517. Today was the 6th highest day for new cases, and while the percentage of new cases has gone down, the number of new cases has not. A week ago, we marked 5,883 new cases for the week. This week, we added 7,301 new cases. In the city, we heard the news today that there are 690 new diagnosed COVID-19 positive cases, and that brings the total in the city of Los Angeles to 11,553, a 6% increase since yesterday. A week ago, there were 428 new cases and a total of 8,450. And today, the part of this evening I hate the most, we learned about 62 new deaths countywide. That brings the total to 1,172 people who have died, a 6% increase since yesterday, the 4th highest day of fatalities we've recorded, which emphasizes we still have a lot of suffering in our city, and unfortunately, more to come. A week ago, there were 52 new deaths and a total number of 848 deaths. Deaths are doubling about every 12 days, and unfortunately, this week was deadlier than last week, adding 324 total new deaths for this week, compared to 272 total deaths last week. And these numbers are painful, especially for those who have lost a loved one, a member of your family, somebody you work with, a dear friend. Every time that number goes up, another family is heartbroken. They're left with an empty seat at the table, a laugh that they won't hear again, a loss that they'll have to learn to live with over time. Like the loss of Ron Ziff, who died on April 13th at the age of 83. His fever had broken, so he was caring for his wife of 60 years when things took a turn. And along with Ethel, who is thankfully recovering from COVID-19, he's survived by 2 sons and 3 beautiful grandchildren. Ron's eyes would light up when he talked about his family. He loved history and he loved LA. And he would tell stories that entwined the two, about visiting his grandfather's food stall in Grand Central Market, riding on Angel's Flight, working in the family business, the old Westward Ho markets in West LA and Sherman Oaks. I used to go to the one in Sherman Oaks with my grandmother growing up. He started as a stock clerk at 12, and he worked his way up in a classic LA story, becoming the executive vice president. I had the pleasure of meeting Ron last year, and he was an LA original. It was clear how deeply he cared about his community. He served on the Sherman Oaks Neighborhood Council for 15 years and always had a new project in the works. He represented the best in us, not only what this city gave him, but how he gave it back. So tonight, let's hold the Ziff family in our hearts. Let's approach tomorrow with the same spirit of love and caring that Ron showed us throughout his life. We're in this together, my friends, and we will get through this together as well. What we're doing is working, and we know that by looking at the infection rate. This is how many people each person, showing symptoms or not, infects. When we enacted our Safer at Home order on March 19th, the city's infection rate was trending upward rapidly and was probably between 4 and 5. Today, it's almost at 1, which means we are flattening this curve. That's huge news. So we are saving lives by staying safer at home, and we need to do that again this weekend. That will help ensure that our hospitals stay below capacity and that they can handle any emergency surge. Across the county, our general emergency hospitals have 1,169 beds available, including 935 acute care beds and 234 ICU beds, and an inventory of 1,210 available ventilators. There are currently 1,959 COVID-19 patients in those hospitals across LA County. And to date, 4,880 people have been admitted with COVID-19 to those hospitals since this crisis began. Although we have been able to keep up through the heroic work of those hospitals and their personnel with the need for beds and ventilators and personnel, as well as personal protective equipment, I want to emphasize another statistic, that 1 in 5 Angelenos who are diagnosed with positive COVID-19 are winding up in our hospitals. 1 out of 5. This remains a very dangerous virus, and one that can spread again quickly like wildfire, which is why the steps in future weeks are so important to do carefully and right. To keep folks out of hospitals and to stop the spread, of course, as I've said each evening, we need to continue scaling up testing. And I'm so proud of the progress that we've made in the county this week. Last week, across the more, now I think it's 35 sites that we have between the city and county for drive-up and walk-up, as well as all the places you can get a test through your providers. We had the capacity just through our sites to test 12,000 people, and we tested a total of 106,000 people, a new record. Today, we have the capacity to test 18,000 people, and by the end of today, we will have tested 165,000 people. Letting unused tests go to waste is unhelpful, especially when so many folks infected with COVID-19 do not have symptoms. We all need to use the tests that we have every day, which is why we made sure that all LA County residents are now eligible to get tested at locations run by the City of Los Angeles. Symptoms or not, you can get a free test. I want to make 2 things clear, though. First, priority will still always be given to our highest risk Angelenos. As we open up the ability for people to have more tests, our first priority has to be those that are sickest. Second, those who are on the front lines. And those folks who are medical professionals will be right up there with people with symptoms, and we have been able to protect that as we've expanded. The city will continue, though, as long as we have more tests, to make them available to everyone. And second, remember that each test only tells you if you had COVID-19 the moment it was administered. If you get tested and don't have COVID-19 today, that does not mean you won't get the virus in the future, and it doesn't mean that you haven't had it in the past. So even if you test negative, you should still wear a face covering in public, physically distance, practice proper hygiene by washing your hands, and protect yourself and others. This is still a moment to be extra cautious, and trust me, I know how tough that is the longer this goes on. It's just human nature to begin to slide, to begin to get frustrated, to say, oh, I don't need to wash my hands as much, or maybe I won't wear the face covering. But remember what you believed in the beginning of this and in the middle of this, and that what our public health professionals tell us, these actions save lives, and we're going to be in this for the long haul. If you've developed a cough and don't know if it's allergies or something worse, get tested. If you're a rideshare driver or one of your passengers you think was sick, get tested. If you live in a household with elderly loved ones or people with underlying health conditions and you get the sense you might be getting sick, get tested. So sign up now at coronavirus.lacity.org/testing or call us at 213-978-1028 or 311 after 5 p.m. Testing is a tool of health, but it's also an instrument of equity. And as I've been saying each night, COVID-19 has affected all of us in every neighborhood and every community, but it has not hit all of us equally. This virus has taken hold of old disparities and forged new and devastating injustices. These are the facts. Statistically, fewer African Americans, Latinos, and Asian Pacific Islander have the option of working from home or taking time off. And during this pandemic, that has put them at a higher risk to exposure of this virus. Higher rates of people in these communities have chronic conditions like diabetes, obesity, and heart disease, and that has meant that this virus is more dangerous in low-income communities and communities of color. COVID-19 has laid bare long-standing inequities, truths that are the result of generations of neglect and discrimination and bias, and it's our responsibility to call those truths out. And everything I've done as mayor, we've tried to do to address those truths in this crisis, to open doors that have been closed for too long, to bring testing where it needs to be, to help bring every child and every community to the same starting line, to acknowledge the scars of our history so that we can work to heal them. And this crisis is no different. We face down a pandemic. Equity and access will always guide our decisions. That's why we're strengthening worker protections. It's why we've required essential businesses to protect their workers. It's why we've worked quickly to expand testing in neighborhoods that are disproportionately dying from COVID-19. And that's why tonight I'm announcing that I've appointed Capri Maddox to serve as the city's chief of COVID response equity. Capri is an amazing public servant, a tireless advocate with years of experience working with our most vulnerable Angelenos, the people who are being hit hardest by this pandemic. Capri's work led me to recently appoint her as the first executive director of the city's new Civil and Human Rights Department, which we are launching this coming January. And as Chief of COVID Response Equity, she will bring this experience, this lens, and all of our values to this fight. Her mandate is to keep equity as the primary lens through which we will refract our reaction at every stage of our response. She'll work on strategies to help more low-income residents and communities of color access available testing, get medical care when they need it for COVID-19 symptoms and for other life-threatening illnesses. And she'll also work with partners throughout the city to identify where the impact of this pandemic is unequal, to listen to their suggestions, to build new strategies to protect people and prevent illness in our frontline communities. As long as this pandemic persists, we will serve every Angeleno, no matter who you are, and we will provide services to every community. When I came into office as your mayor, I pledged to get City Hall back to the basics. This promise has continued throughout this crisis. But with this pandemic changing our routines as individuals, as families and communities, it's also made us think about how we can change vital city services, how we can gear our activities toward both serving your daily needs and stopping the spread of this virus. That's why we've relaxed our parking restrictions, why we redirected our street sweeping and paving projects, boosted trash collection, and more. And in recent days, we've extended those efforts. Our Department of Transportation has expanded the number of intersections where the walk signal will come up automatically without you having to press a button. This is happening now at close to 900 intersections across Los Angeles and being implemented near about 24 hospitals in particular. The reason to do this is straightforward. If COVID-19 finds its way, the coronavirus more exactly finds its way onto one of these pedestrian signals, it can spread from person to person to person. More folks might get sick, so this seemingly small step can actually save lives at our crosswalks. And we're doing even more to protect the health of Angelenos who are making essential trips on public transit. Streets LA has doubled the frequency of cleaning at our transit shelters, installed 300 touch-free hand sanitizing dispensers at the highest use stops throughout every council district in our city, so that anyone who needs to hop on a bus to get to work or to pick up your prescriptions at the pharmacy don't have to worry about getting the coronavirus where you are. We want the safest possible environment for everyone. And all the while, I want to assure Angelenos that our sanitation department enforcement efforts remain intact, to keep our sidewalks and our streets clean, in our communities, near our businesses, everywhere. I said we'd crack down on illegal dumping, and we have. And even as our response to COVID-19 has forced us to reorient many of our resources, that has not stopped. In March, the number of infraction citations and warnings hit 36, more than double the 16 logged in March of 2019. And every single one of these actions is meant to meet the same mission, to protect the city services you deserve and to stop the spread of a virus that is a public health emergency. Every step that we take to confront this crisis, as a government, as a community, as Angelenos, comes from our hearts, what I've called LA love. Love for our families, love for our friends, our neighbors, and strangers across this city who are all lucky enough to call LA home. That love isn't contained, though, solely within our city limits. We take it with us wherever we go, and when we have the ability and the opportunity, we do our best to give back to our hometown. That's the case with Jenny Lee, raised here in LA, now a student in Massachusetts at Harvard College, and a former member of the Mayor's Youth Council, where a special group of young Angelenos learn and can serve here, building on a model Tom Bradley started about the power of public service. When this crisis hit, she got involved with Off Their Plate, a group that's putting restaurant workers back on the job preparing meals and getting them delivered to medical staff who are working to protect lives. This effort started in Boston, but Jenny then turned her sights to her hometown, here in LA. And she reached out to Serena Iyer, a local leader in the organization, and together, their campaign has brought more than 6,000 meals from local establishments to 14 LA hospitals, with more in the works for the weeks ahead. That's the Angeleno spirit at work. That's the spirit driving us to keep lighting City Hall blue. It's the spirit that is showing our nurses and our doctors and our medical professionals, our janitors who are cleaning our operating rooms and our exam stations, how much we care about them and how much we appreciate everything that they do. It's the spirit that's continuing to push us to follow our safer at-home orders, even when it gets tough. As we reach another beautiful weekend here in Southern California, I can't emphasize enough that our beaches and our trails are still closed. And as I've always said, the sooner we can open them rests on us being disciplined now, not slipping, keeping with staying at home order, so we can continue getting the numbers we need to look at steps in the days ahead. So please do not spend your Saturday or your Sunday heading out for a swim in the Pacific or a hike in the hills. It's not worth it. That day is coming, but it is not this weekend. We all want to chart a path towards reopening. We all want to be with our families in these beautiful spaces. We all want to keep up our slow but steady progress towards the phase of recovery. And trust me, we will get there, Los Angeles, and we will get there together. But that starts with what you do now to stay safe and to stay healthy and to stay at home. I'm wishing you all love and strength from my family to yours this weekend. We'll see you on Monday, but before that, I'm happy to answer questions. Thank you so much. I'll take the first question.
First question comes from the line of Claudia Pisciuto, KNX News Radio. Please go ahead.
Hi, Claudia.
Hi, I'm sure you saw the protests happening outside City Hall today, and
Which one? I think there are a lot.
I understand that you say your decisions are going to be guided by what public health officials say, but you can tell that some people, at least, are getting restless. The governor is talking about using some restrictions next week, so I'm wondering if the thought is still to go through May 15th, or if that's something that you're possibly reevaluating at this point. Second question. People are saying that they're not able to find a testing appointment at this point, that they're just getting a message that says no appointments are available, check back later. So can you talk about,
Sure.
Is the system being overwhelmed at this point? Will more slots be added? Thank you.
Absolutely. Let me start with that. Actually, the system's working great. You can get that in the morning time because we always want to make sure that people with symptoms and our first responders aren't overwhelmed. So I encourage people to check back during the day because those usually open up towards the afternoon. I have the stats today. I think we did about 8,000 tests 12,000 tests. About 3,000 of them were for folks that were asymptomatic. That was about the total number of tests we were doing last week on any given day. So that was just for people without symptoms. 5,000 of those were for folks with symptoms, and 4,300 for frontline workers. We know that that's sometimes folks are going to the next day or 2 days ahead. Right now, I think we're fully booked for tomorrow and maybe even Monday, but we're very confident about being able to add more tests to that. And we do encourage people to go back afternoon when oftentimes we see, okay, of the 5,000 that we were reserving for people with symptoms, only 2,000 people with symptoms. We also have had a lot of no-shows. Maybe a third of people won't show up. That's been consistent through the time we've done testing. So each night I've told people, go back, get back on there, but we're very confident we can keep up with the demand that has been out there. In terms of the protests and stuff, look, I totally respect that. I'm frustrated and I want things to reopen, but 2 or 3 things to remember. One, we have to follow public health advice. This isn't about one politician versus another politician or one state versus another state. I'm going to continue listening to the professional medical advice that I get from public health. Second, we have to have a collaborative process. And as I mentioned yesterday, it's been wonderful to work with 88 mayors across LA City, our superb board of supervisors, and I'm on calls almost every single day talking about what will the process be, not just for May 15th, but May 15th is just one day where we may see the order revised. 2 weeks later, it could get revised again. 2 weeks after that, it could get revised again. It's going to be a very dynamic year ahead of us, where I hope we can have a process where we take baby steps. We assess those for a while before, which is what we're doing right now. We assess them after 2 or 3 weeks to see the impact, and we say hold, retreat, or proceed. If it's successful, maybe you can sometimes proceed. If it's stable, you hold. And if it gets worse, you have to retreat as well, because we know that lives are at stake, and overwhelming the hospital system is something that is unacceptable to us all. Third point I'd make is, while in the city we could move forward with more restriction at the beginning, this will be something in which the state and the county will be the leads on. But I intend to bring the voice of community and of industries and people who are saying, here are safe ways that we propose to get those openings, and then work together with my fellow mayors of LA County, across all 88 cities, and our Board of Supervisors to arrive at those things together. So I'm confident. I don't think we'll be doing it earlier than May 15th. As I said, I shared at the beginning of this, more deaths this week than last week, more cases this week than last week. So while the rate of increase is slowing, let's be clear. There are more people dying. There are more people that we are diagnosing as being positive each week. And so we have to balance those things about human life with making sure we take safe steps forward for both our psychological health and our economic health. I'm confident that we can do that in the next 2 weeks. Thanks, Claudia. Next question.
Next, we go to the line of David Sennheiser with Los Angeles Times.
Hey, Dave.
Go ahead.
Hi.
Hi.
So today, a homeless man went into the Ritz-Carlton at LA Live in downtown LA and refused to leave, saying he wants you to order hotel owners to open up their doors to homeless people. And up till now, the city and county have opted to negotiate with hotel owners who are willing to participate in the program. So I'm wondering, are you disappointed by the slow progress being made on Project Room Key? And do you think it's time to commandeer hotels, which is to say, force them to rent their rooms to homeless people? And if not, why not?
So I wouldn't, that's your characterization that slow progress. I look always at a very important number of what percentage of the rooms we've already signed are occupied. Because if they're 99% occupied, yes, I would say it's moving too slow. But here's the numbers so far. Out of 1,631 rooms that have been signed on, 1,272 of those are occupied. That's 78%. So there's plenty of capacity. And I would say to that individual who's experiencing homelessness, who wants to go in, we have a room for you tonight, and we want to house you. We want to make sure that anybody who is in danger of contracting COVID-19 knows that there is a place for them to put their head tonight, this very night. Doesn't always mean the exact hotel that you might be knocking on their door, but there is a place tonight. Those are tier 1 for healthy people who are vulnerable, meaning that they don't yet have COVID-19, but they might have underlying conditions, they might be living on the streets, they might be of a certain age. Tier 2 ones, which is folks who are already sick as well, 409 rooms, 314 of those are occupied. So that's a 77% occupancy rate, which means tonight there are rooms. And I'm very proud so far of the outreach that's been done. Let me see if I can get the latest numbers. I know it's more than 5,500 wellness checks have been done on people who are experiencing homelessness. We've now done, in terms of the number of tests for folks who are experiencing homelessness as well, I think close to more than 2,000 of those, including pop-up testing that we've done in Skid Row, as you know, here in San Pedro, in other parts of the city where we see encampments. So those rooms are available. But then the last point, I wouldn't disagree with you, Dave, in this way. We can't have too many hotel rooms. And as I've said all the time, absolutely, I will use whatever emergency powers are necessary. They do come at a price, and they do come at a cost. So you can't just commandeer and not pay for those things. So if that means that suddenly we wouldn't have tests or we would have to lay off city workers or something, there's not a bottomless amount of money for that. But because there is capacity, I'm convinced that right now we're meeting the need, and I'd like to see that continue. And as I've teased a couple times, there are rooms that are continuing to be signed, and I think we have some big ones, including one downtown that we're days away from announcing. And I'm sorry, I got a correction. It's over 5,000 now. It's 6,500 wellness checks. Thanks. Next question.
Next question comes from the line of Basic with NBC. Please go ahead.
Hey, Robert.
How are you, sir? Glad to hear that the cough is no longer with you.
Don't worry. It was just something in my throat last night. I'm all good.
So here we are on May 1st.
Yep.
I heard what you said to Claudia, that you don't think we'll be doing anything earlier than May 15th. Governor Newsom says it's going to be days, not weeks, before restrictions are going to be lifted. So you're saying that, just to clarify, here in LA County, you don't see anything being lifted at all before May 15th. And will we be following those federal guidelines that we need to see trends in cases on a downward slope for 2 straight weeks before we should do anything?
Great questions. First of all, on the first one, I always give my snapshot of tonight. So that's just a snapshot of tonight. It may be that public health says, here's a couple things we can do before the 15th. Absolutely open to those. I would never do those alone. I think that's important for the cities of LA County and the county to do together. So I know that we have our teams working Long Beach and Pasadena that have their own health departments. LA County, which is the health department for the rest of us, and my office are talking every single day. And there's certain things, I'd love to see if they get the green light to go even sooner. But my snapshot is really May 15th is, I think, the day that thoughtfully you'll see the beginning of baby steps. But to be clear, they're not going to be giant steps on the first day. Everybody's preparing for a big party or the doors fly wide open. That would kill so many people in this county. 96% of us, maybe it's a little bit less now since the USC study, but over 90% of us can get infected, which means if we don't do this the right way, all the progress we fought for, all the time we spent at home would be for nothing. And we would see tens of thousands of deaths potentially here. Secondly, in terms of the first part, sorry, it was about opening up, or what was I think that was it.
The government phase about are we going to have to see a downward trend in cases
Sorry, yeah, that was
for
right.
2 weeks before the government recommends anyone starts phase 1?
Thank you. That was
Or
your
phase
second
2.
question. Correct.
Yeah.
So those are good guidelines, but I'd say two things. Diagnosed cases is different, for instance, than deaths. Diagnosed cases can also depend on how many tests are available. So I like looking at a 7-day average. First of all, as we've seen, sometimes there's data dumps, so you're going to see a huge spike one day. Even sometimes the death numbers I think we're getting might not always reflect a 24-hour period, but just when we get those reports from hospitals, and they can sometimes be clustered for a day or two, as we saw a few weeks ago when we had the highest number in a single day. I think it was 81, and then suddenly 17 deaths the next day. So it is a good measure, but you have to make sure that you're not just measuring that more people are getting tests. Second, deaths are a more honest number because you cannot fake a death. That is something that is written in stone. But we also know that death is usually a lagging indicator because it takes time for those people that we've lost for them to get sick and to die. So it's not a good daily measure. So we're looking at a series of different metrics. We'll be talking a little bit more about this next week, and the county's looking at this and my fellow cities as well. But that is one good measure for 14 days. Have you kept steady or gone down on the average, 7-day average each day? Another good measure is hospital admissions, because really what we're fighting for is not overwhelming our doctors, not making it so that our capacity can't meet the need, and that people aren't dying in the hallways. So that, to me, if you continue to have good numbers of admissions that are lower than the number of beds, that's also, I think, a really important measure for when you can open things up a little bit. And then you got to measure it. If you suddenly get a whole bunch of people coming in, you've got to know something's happening out there and potentially close the door a little bit. So those are 3 of the measures I'm looking at, and they're absolutely critical, but no one of them will single-handedly make the decision for us. Thanks, Robert.
Thank you, sir. Have a good weekend.
You too. Appreciate it. Next question.
Next, we go to the line of Alex Michelson with Fox 11 News.
Hey, Alex.
Go ahead.
Happy Friday, Mayor.
Happy Friday to you too.
Those protesters outside City Hall, most of them not physically distancing. The same thing we're seeing up and down the state. Are you concerned at the way that these people are flaunting the suggestion that you're making, and that might be a sign that people are ready to just sort of ignore what you guys are saying needs to be done?
Sure. Look, exercise your constitutional rights. That's important. It's part of being American. It's a spirit of Los Angeles. There isn't a May Day that's gone by since I've been a public servant here for 2 decades that there haven't been robust demonstrations, protests for immigrants, against officers, for the closing, against the closing. All these things are important. But please, it's not a mayor telling you to do these things. It is a doctor telling you to do these things. These are medical professionals telling you you're putting yourself, your loved ones, anybody around you, and strangers at risk. So of course, while you're exercising your constitutional rights, folks who are driving around City Hall or whatever, honking their horns, they're staying safe. Folks who are there not physical distancing from each other, absolutely. That is something that is in violation. We're seeing that around the country. And look, I don't want to look back whether I agree with somebody or disagree. And we all agree with certain things and disagree with other things, but we care about each other. I care about those protesters not getting sick. I care about their lives. And I don't want to see, looking back, that was a moment in which things got spread. That's the same reason, whether it's our beaches, whether it's our trails, whether it's our workplaces, or where we protest, we have to be smart, and this isn't going to be over soon. So whatever we do, whether it's work, whether it's play, whether it's protest, do it in a smart way. And please listen to the doctors who know and who have seen the consequence. If we don't, it means people die. If we do, we can maintain those rights and we can exercise our freedoms better. Next question, please.
Next, we go to the line of Ben Oreskes with LA Times. Please
Hey,
go ahead.
Hey, Ben, how you doing?
Good, Mayor. Thank you, as always, for doing this.
course.
I just wanted to follow up on one thing Dave mentioned. We have been seeing rooms being kind of taken for homeless people or being used by homeless people. And again, though there has been this lack of rooms downtown, we heard from you last week that said that was on the horizon. We heard that again tonight. We've also heard that activists want to see rooms that have received taxpayer subsidies be open to homeless people. Has your team reached out to, an LA Live, a Wilshire Grant, and the others that have received this taxpayer support to ask them if they'd be willing to do this? If you have, what did they say?
I don't know yet where the negotiations are. I know we have reached out to those hotels. I think that's absolutely appropriate. I've spoken with Councilmember Mike Bonin, who I think introduced a motion specifically on this. Absolutely. Look, we've helped get jobs. We've helped hotels get built. We've helped their workers, whether it was focusing on the out-of-work hotel workers that now are preparing meals for our seniors, or whether it's an opportunity for hotels to make money right now and do something good. Absolutely. I hope that people will do it for their bottom line, and that they will also do it because it's the right thing to do. But we've called more than 800 hotels, the owners of more than 800 hotels and motels. So I would continue to encourage folks to get to yes, to say yes. We do have capacity tonight, whether you're sick or not sick, in hotels, so that's good news for anybody out there worried. And if you have somebody that you know of who needs that housing, please do refer them through 211, through the county, to those hotel rooms, because they're available. And I'd like to see statistics where those rooms are growing every night and they're at 90 to 100% capacity, because this crisis calls on us to do that. Thanks, Ben. All right, I'm told there's no more questions. All right. So I'll be switching to Spanish for my address. I want to wish everybody a good, healthy, safe weekend. Thank you again for hanging in there, and I will see you on Monday. Have a good weekend. Muy buenas tardes, Los Ángeles, y gracias por venir esta noche a la Alcaldía de Los Ángeles. Hoy estamos al final de otra semana en casa. Ya estamos cansados de esto. Queremos regresar a nuestras vidas y saber cuándo podemos empezar a tomar pasos para protegernos. Les aseguro que lo que estamos haciendo está funcionando. Estamos aplanando la curva, pero este virus sigue siendo muy peligroso. Hoy es el 1 de mayo, el Día Internacional de los Trabajadores. Y nos podemos quedar en casa gracias a nuestros trabajadores esenciales, quienes están manteniendo nuestra ciudad cada día. Hoy los celebramos, pero no solo los celebramos hoy, todos los días los respetamos con asegurar que estén seguros con las medidas protectivas críticas. Los cuidamos a ellos porque ellos nos cuidan a nosotros. Ahora les comparto los datos de hoy. Hoy hubieron 1,065 nuevos casos en el condado de Los Ángeles, llegando a un total de 24,215. En total, esta semana, nosotros hemos tenido más casos en la semana pasada. En la ciudad tuvimos 690 nuevos casos, llegando a un total de 11,553. Y hoy fallecieron 62 personas más en el condado, llegando a un total de 1,172 almas perdidas. Lloramos con todos quienes han perdido un ser querido en esta crisis. Y esta semana perdimos más personas de en la semana pasada. Cuando implementamos nuestro orden, más protegidos en casa, nuestra tasa de infección estaba entre 4 y 5. Y hoy casi ha bajado a 1, lo cual indica que el quedarnos en casa está trabajando, gracias a su trabajo. Estamos salvando vidas, asegurando que nuestros hospitales no sobrepasan su capacidad. En nuestros hospitales tenemos 1,169 camas disponibles. Entre ellas, 234 están en las unidades de cuidados intensivos y tenemos 1,210 respiradores. Y nuestra capacidad para hacer pruebas también nos ayuda en esta lucha. Hoy tenemos la capacidad de hacer pruebas a 18,000 personas al día. Y para el final de hoy, habremos hecho pruebas a 165,000 personas en el condado. Debemos utilizar todas las pruebas que tenemos. Personas que no muestran síntomas pueden infectar a otros. Y por esto permitimos que todos se hagan la prueba, tengan síntomas o no. Sin embargo, para ser muy claro, estamos dando prioridad a los angelinos con la más alta vulnerabilidad trabajando en la frente de la crisis y personas sintomáticas. Y también recuerda que la prueba indica si tienes el virus en este momento, no indica si lo tuviste antes ni que no lo tengas en el futuro. Y aunque resulta de tu prueba negativo, todavía debes mantener las medidas de sana distancia y cubrirse la cara en público. Puedes hacer una cita para una prueba en la página coronavirus.lacity.org/testing o llama 213-978-1028 o al 311. Esta enfermedad nos ha afectado a todos, pero no de la misma manera. Esta pandemia nos ha mostrado el resultado de generaciones de discriminación y abandono. Por eso estoy nombrando a Capri Maddox para servir como la jefa de equidad en respuesta al COVID, para enfocarse en estrategias para asegurar igualdad en nuestra respuesta a la pandemia. Además, seguimos avanzando en nuestro trabajo para ajustar nuestros servicios municipales en la pandemia. Nuestro Departamento de Transporte ha aumentado el número de intersecciones que cambian la señal para cruzar sin tener que apoyar un botón a 900 intersecciones y cerca de hospitales. Y nuestro Departamento de Servicios de Saneamiento ha aumentado la frecuencia de limpieza de nuestras paradas de bus y ha instalado 300 puntos con desinfectante para sus manos. Mientras entramos un nuevo fin de semana, les recuerdo que los caminos y las playas permanecen cerradas. Por favor, no tomen el riesgo de salir a pasear. Les prometo que estamos en camino para la reapertura poco a poco. Este es nuestra meta en estos próximos días y semanas, a reabrir partes de nuestra vida, de nuestra economía, de nuestra prosperidad y de nuestra salud. Mientras tanto, quédense en buena salud, quédense protegidos y quédense en casa. Mucha fuerza y mucho amor de mi familia a su familia. Y hasta lunes. Gracias. Thank you all.